into the Ask the Doc?
Let's do it. So today's question comes in, what can I do, Doc, to treat tennis elbow or golfer's elbow? So for those of you who are watching on video and those who are listening, we're talking about pain on the inside and outside of the elbow and some things that we can be doing or maybe things that we're doing to create more of an issue. So let's start with issues related to wrist movements.
So most people tend to think of elbow pain and they think, well, what am I doing at the elbow? And it must be where I'm bending my lower arm and my upper arm, and it has to be there. Well, in reality, that's not really the case. So most of the tendons that cause tennis elbow or golfer's elbow, they're the origin of the muscle that come down and they actually cross the wrist. So and here's a little bit of background as far as why they're called tennis elbow and golfer's elbow, because it kind of explains a bit. So if I'm a right-handed tennis player and I was doing a backhand, it's that flick of the wrist extension, and then I flick the wrist, the ball hits the racket, which creates tension and leverage, and that tugs on that origin, which is at what's called the lateral epicondyle, that bony part at the outside of the elbow, thumb side of the elbow. That creates a chronic inflammatory change. Well, first it's a little micro trauma, and then that becomes an inflammatory change, and then over time it becomes more chronic, and then you've got swelling and pain. It's not about treating the elbow. I have to minimize some of the movements at the wrist because, again, that muscle that comes off of there that started the inflammation in the first place ends up crossing the wrist. So with golfer's elbow, if I'm a right-handed golfer, I'm going to come through, and it's really the exact same thing, but at the end of that downswing, and I suck at golf. I tried last week and I've been sore all week. So I can't really give you a lot of the golfing advice.
I wish I had a video of this, by the way.
Oh my God. No, you don't. I don't want you to have a video. But you flick that wrist a little bit at the bottom, and as you hit the ball, again, you have the resistance. So the flexor tendons that come up the palm side of the wrist, and then they originate at the inside of the elbow at this what's called medial epicondyle. So it's realistically the same thing, just which side of the forearm you're looking at the muscles that were causing it in the first place. So we have to treat the inflammation, okay? And part of that treating the inflammation is going to be icing, of course, but in the grand scheme of things, we have to stop that tendon from getting the chronic aggravation. Mm-hmm. I know they make those little strap things, and they'll call it like a tennis elbow or golfer's elbow strap, and their point is that it comes across, and it's just a little bit below where the pain is, and it's supposed to create like a new tendon attachment site where the muscle connects to the bone. It's supposed to basically force the forearm muscle down and stop it from pulling up higher. They don't work. They suck.
Just a temporary fix.
Yes. Yeah. And most people have too strong of a muscle up here in their forearm who got the problem in the first place. Their muscle's too strong to be stopped by that little brace. Mm-hmm. It's not really worth it.
Pushes it up.
Yeah. So I usually recommend to my patients to brace the wrist, and that way you're really not firing much at all. And, even though they're the quote-unquote carpal tunnel braces or whatever, they come across here and they stabilize that wrist, and sleeping in them.
Cock-up splints? Is that what they're called?
Mm-hmm. Yep. You just wanted to
say waiting that for that.
You just wanted to say that on radio.
Trying to work that in.
But a lot of us sleep in a flexed position. And when we're sleeping like that, that can tear you up too. So you wake up and the pain, many people wake up and their pain is much worse at that point.
So the other thing that I'll always include too, if you don't mind me sharing,
Absolutely.
is some mobility work. So if the person is going to go out and play golf or go out and play tennis or go lift weights, whatever it may be, I even see it getting stressed in push-ups. We can call it push-up
sure.
elbow, and we can talk about that too. So I do think that when we're having an issue at the elbow, we have to look downstream at the wrist and figure out what are our abilities for mobility at that joint, and then also we go upstream to the shoulder, because sometimes if the shoulder doesn't move a certain way, that'll add more demands on the elbow too. But specifically for tennis elbow and golfer's elbow, we'll try to find ways to warm up the tissue where Craig pointed to in the video, and I'll try to describe over the audio. At that medial attachment point, the medial epicondyle, we need to soften some of the flexors of the palm or the wrist, and then on the back side of the or on the lateral side of the forearm, we need to soften some of the wrist extensors or finger extensors. So you can do some work with tennis ball, lacrosse ball. There's some really great warm-ups that we can do in a quadruped position from the original strength thought process, and those are awesome because within just a few minutes you can really get closer to that 90-degree extension, and we can start playing around with a little bit of palmar flexion as well. So I know that in the beginning we don't want to add heat, but over time, if it becomes chronic, sometimes I find that as we can create more of a blood flow and more of a loosening up, heat can be beneficial in the chronic category. But I will agree, in the beginning, we got to ice it and try to stop touching the hot stove, so to speak. Quit, if golfing or tennis is creating the issue, let's back off just a little bit to give it time to heal. If not, they can turn chronic. How many times do you see it just lasting for a really long time?
Tons.
Yeah, and then laser.
Yeah, laser. So in my office, we have what's called an MLS laser. It's a class 4 medical laser. Works really, really well from an anti-inflammatory status. Also helps heal the tissue from something called photobiomodulation. I'm not going to take the time to explain that here. You can look it up. But it really helps heal the tissue at a cellular level. So it stops some of that injury process. I had my daughter there this morning before our episode. She got burnt. She sat on a marshmallow hot like poker stick thing. Burnt the crap out of the back of her thigh. So she looks like she legit got branded.
Oh no.
So our laser can treat the inflammation, but it also heals at a cellular level. So I was in there this morning like treating this. So
That's
hopefully
super
she
cool.
doesn't have a ridiculous scar. But
You also mentioned too, just how to rehab with a flex bar. So please go into that a little bit. What you said, TheraBand makes one.
yeah, TheraBand makes one, and there's some off brands too, so you can Amazon it or whatever. I'll try to get a link up on. But there's a specific protocol, and we will do a video, and we'll coincide this with this episode. But there's a specific pattern of rehabbing that you kind of work with the extension or work with the flexion. And what the cool thing about those bars is they will give you a resistance in both directions. So you can do it like in the negative and the positive, and there's a specific protocol. So we'll go over that in the video. But the thing about rehab is you can't do that. It's not effective until you've gotten the inflammation calmed down. So what I always do is do all the things we can do to get it stable first and then rehab it. Because if you try to do that too soon, all you're going to do is stoke the flames, and it's just going to be really, really aggravated.
Do you find that similar to what we talked about in previous episodes about the Achilles tendon and the tendinopathy and creating pressure and compression? If there's still inflammation in there, it's going to come back up until we get it completely resolved.
Yeah,
Good point.
you got to get it calmed down. I usually try to avoid cortisone if at all possible. Now listen, I'm going to tell a story. I had pretty bad tennis elbow myself, and it was not from tennis because I don't play tennis. It was from adjusting people. And it was to the point where things in the gym were irritating it a little bit, but that wasn't too bad. But adjusting was killing me. I have to go to work. I'm not independently wealthy, and I got to go to work. And I had to deal with cortisone shots. I know we've talked about Dr. Ko. He's one of my best friends, and he gave me some cortisone shots. And I think over maybe a 3-year period, I had to have about 5.
Wow.
So it worked. Every time he'd do it, I'd feel better for 6 months. And it wasn't because I knew that, or I thought that this was a great thing. It was because I had to go to work and I couldn't stand working with the level of pain and inflammation. Now, mind you, I was still doing all of the right things, doing the icing, doing the wrist mobility, doing the forearm mobility. I was doing Graston types of techniques and whatnot, and ART on my forearms. All the stuff we were talking about here. I didn't have the laser at the time, but I went this past year in 2018. I had to get an MRI on my bicep, and I found that all of my ligaments in my elbow, they're gone. Literally
Really?
gone. Yeah. I have no ligaments holding where they did the injections anymore. They're they're just gone.
So for the video, can you point to where they did the injections?
They did the injections right on, I'm almost wondering how you get the needle there, because it's almost into the bone, but he just goes right to the side, and then fortunately he used the Freezy spray because I'm a pansy with needles and I don't like that.
Same.
But he did the Freezy spray, and I'm sitting there looking away, and he jab in there right at the site of pain. And again, I felt better. He put a little bit of numbing stuff on the inside as well. So I felt a little bit better instantly, some pressure from the fluid. Maybe 3 or 4 days later, I was doing better. It wasn't perfect, but it was doing better. And then it kind of subsided, but I was still doing the other stuff. It was enough to kind of calm that fire down and allow me to then push through. But 6 months, 7 months later, it would just irritate again, and I'd have to do all the same things over again. And now I'm without ligaments because of the cortisone.
So if you guys didn't catch that, the ligaments have deteriorated
Yep.
because of some of the cortisone injections. So be really careful what you guys decide to let go into your body from your doctor.
Yeah, it definitely weakens the tissue. But really, that's the main protocol. Controlling that inflammation. Kinetic Cream works phenomenal for controlling the inflammation as well, because we can only ice so many times a day. I've got a couple videos out on doing this. And the other thing that I want to point out in the lifting world is knowing what neutral is for the wrist. Mm-hmm. So this is going to be on the video. So if you're listening on the audio, please tune into the video. But neutral for a wrist requires the thumb web to be in line with the forearm. So if I had a bar or a machine and I had the weight of that behind my forearm or in front of that, I am no longer in a neutral wrist position. So it's all about that thumb web and making sure that whatever bar I'm using or machine I'm using, that the pressure goes right through my hand, right through my carpals, and right down into my forearm bones. If I'm behind or in front of that, I'm overstressing either the flexors or the extensors. So that's kind of the important part of that.
For our chiropractors out there, our manual therapists or PTs, when we're adjusting, let's say the cervical spine, same idea, right? Same focus. And if you could show a little bit too, where you'd say, like earlier when we were off air, you mentioned about displacing that pressure as we come across and deliver the adjustment a little bit differently on the hand.
Correct. Yeah, just trying to be able to get that arm down, and then you can drive across, because if we get cheaty, we're
lazy in the
cheating
wrist,
and lazy and just kind of flex it out or whatever, then we're going to damage ourselves. And like I said, that was kind of where I was at, and I had to eventually alter it. Now I have no more ligaments. I don't really have any more no more tennis elbow. But get anything else on that, man?
That's it. No, I think it's great. One other thing too that this person had mentioned, would compression help? So you see those like sleeves and stuff. Mm-hmm. I feel like it could help kind of keep everything. It always feels good if I come over and I hold, your forearm or what have you. It doesn't fix anything, but compression can be helpful. What are your thoughts?
Stabilization, absolutely. In the gym, I used the Inzer wraps for a while when I was really bad, and I was trying to get through some of the workouts, even though, again, I don't think that it was doing anything at the tendon. It was just kind of giving me an overall compressive, nice feeling. So it helped me kind of get through the workouts.
I think you put kinetic cream on first, and then you pulled the sleeve up to kind of help bake it into the tissue.
Yeah, and you do have to watch that. Just because we always get a little leery with compression. We don't always know what's going on. If you know and have already been diagnosed that it's tennis elbow, then you can definitely do the kinetic cream and then the sleeve. If that's not been diagnosed by a professional, then you got to watch, just because if it were anything like infectious or anything weird, you got to watch putting compression on, or cellulitis. You can have a problem by doing compression. So,
little disclaimer there for you guys.
Yeah. Well, we got the one at the front end of the show, and I hope people
super fast. Yeah.
Me in hyperspeed.
So. I love it.
All right.
Final thoughts?
Final thoughts. We're going to take a quick break, and then we'll come back with our final thoughts.
Okay.